Hey guys, I quickly want to talk to you today about why casts for anything except a broken bone and why using ice for an ankle sprain will increase the recovery time. So I had a new client recently who had been suffering from shin splints, which is basically caused by poor biomechanics in the ankle and very common in runners and those doing repetitive activity. So she went to the most prestigious and expensive hospital in town, and the treatment she got was basically they put her ankle in a cast and sent her away. Now, in my opinion, this is the worst thing that they could have done because casts holds the joint in the same position for a very long time. All the muscles, ligaments and tendons get shorter and weaker. So in overuse injuries, after the cast is taken off, you're in a worse position than you were before the cast went on. After my client took the cast off and began running again, the pain in her shins returned. Therefore, even though I have the highest respect for doctors, they don't all have a great knowledge of physical therapy. Prescribing the use of a cast after a soft tissue injury is traditional and thought of as risk-free, but in reality it's pretty outdated and actually counterproductive as it lengthens the recovery time. So what about cast for soft tissue injuries like an ankle sprain? Well, this is also unadvised. We think of rest ice compression elevation as being a good treatment for ankle sprains. However, I've explained why rest or immobilization is bad. And basically when you sprain your ankle, the ligaments are misaligned, so when you use ice it just freezes and tightens the ankle in a wrong position. And also stops the swelling, and swelling is good because it brings in a lot of healing agents and takes out all the crap. So basically, if a doctor or a medical professional has told you not to exercise or whatsoever due to anything short of a broken bone, I would still recommend going and seeing a knowledgeable trainer or physical therapist, see what they think. I'm sure they can give you some exercises you can still do. In fact, exercising while injured can not only help you recover faster through increased blood flow and release of healing hormones, but it also makes you feel better, and especially if you're trying to lose weight, doing something is better than doing nothing. Thanks guys.